listening to the Pharmacy Podcast Network.
You're listening to the NASP podcast. This specialty pharmacy podcast is a collaboration with the National Association of Specialty Pharmacy and the Pharmacy Podcast Network. The mission of the National Association of Specialty Pharmacy is to improve specialty pharmacy practice by promoting continuing professional education and certification of specialty pharmacists while advocating for public policies that ensure patient access to specialty medications. As the healthcare industry's leading podcast dedicated to the pharmacy profession, the Pharmacy Podcast Network is proud to bring our listeners the NASP podcast, in collaboration with the National Association of Specialty Pharmacy.
Hello, my name is Sheila Arquette, and I am the President and CEO of the National Association of Specialty Pharmacy. I am delighted to welcome two very special guests, Tim McLeroy and Terry Spalding, to this episode of the NASP podcast. Tim McLeroy is the Executive Director of Marketing and Patient Services at Noble International. He has a wide breadth of pharmaceutical experience spanning the past 27 years that includes working in the lab, hospital, and pharmaceutical segments, marketing and commercial development, as well as multiple combination product launches and patient experience programs related to adherence. Terry Spalding is the Senior User Experience Human Factors Researcher and a registered nurse. Terry currently is overseeing research initiatives for Noble, including how to design and develop comprehensive and user-friendly patient engagement solutions. Terry has also been a registered nurse since 2005, working in areas such as injectables, hospice, and ICU, and has extensive experience working with patients across various therapeutic areas. Tim and Terry, thanks so much for joining me today.
Thanks, Sheila, for having us.
Happy to be here.
Terry, what do you think is the main reason HCPs don't have the time to provide patients with proper training support?
First off, Sheila, thanks for having us as well, and thanks for the question. You know, it's being a healthcare provider myself. I can tell you, there's always someone waiting for your attention. It doesn't matter how much time you plan for something, or if you do have something planned out. There's always seems like there's something happening in healthcare. And you know, it's funny. We ask these HCPs and we talk to them because routinely we do research, speaking to doctors and nurses and frontline healthcare providers, and you know, we ask them what's a challenge with injection training, what's a challenge with getting patients on a new medication, and it's time. They tell us over and over it's time and staffing. So a lot of it is just having the right number of people at the right time. You know, a big part of healthcare is on-time training and effective training. Perhaps for some of these patients, you know, even if their HCP does have time to train them in the office, maybe it's not the ideal environment for them. You know, maybe the best environment would be something more like in their place where they're going to be taking their injection, or in their home, or somewhere like this. So not only is it necessarily a time problem sometimes with getting through to these patients, but sometimes it's the setting itself.
Specialty pharmacies are best positioned to provide patients with training support, but why might this not be working the way it should, Tim?
Well, Sheila, I think there's a number of factors, but you know, as we've been doing research over the last couple of years, it's not that services and training and education isn't being offered. I mean, that's one of the differentiating aspects of a specialty pharmacy, and it makes sense that the HCP or the folks that are delivering the medication should be involved in how to use that medication. I think a lot of it is we're starting to look at it and uncover it. And Terry, I'd like to get your perspective on this as well, is the timing in which we're asking those questions, right? When that patient is well, first of all, we find a lot of patients don't even understand what specialty pharmacy is, right?
Correct.
So they hear the word pharmacy, they're locked into the brick and mortar CVS and Walgreens that are on the corner. They don't understand what's being the definition of a specialty pharmacy, that it's expensive medication, it's handled in a different way. But when you say words like benefit verification and prior authorization, those are words that patients don't understand. And so, but what they do understand is they do understand and hear that the medication is expensive, right? Mm-hmm. And so as they're going through that process, training may be offered. I'm sure it is offered in the normal intake process of a specialty pharmacy as they're onboarding these patients and going through that process. but I think it's a time in which the question is asked, because at that moment, first of all, the doctor has probably prejudiced the patient in one sense, where they said, I'm going to write you a prescription for a medication that's self-administered. By the way, it's really easy to use. And so they've told them that it's easy. They say they probably assume that it might be training will be offered later, but that patient doesn't know that they're going to have a challenge. They haven't encountered the moment of truth when they're home alone by themselves at that point. So I know that it's being offered through the specialty pharmacy, but I'm not sure it's being utilized. And Terry, I'd like to get your perspective on that as well. You've researched in this area some.
Yeah, the fascinating part is, a lot of times in research, when we're talking to patients who are maybe naive to any kind of injection or any sort of home procedure at all, they don't know a specialty pharmacy exists, and you kind of mentioned that. And the only way, and when we try to introduce them to it, we introduce is like a mail order pharmacy, and then they're like, oh, okay, they sort of understand that. But to them, they really don't see the capabilities that these specialty pharmacists have. And Tim, you were saying, they've had multiple probably times of education with this. They've had a physician that maybe introduced them to the medication. They might have come back to the office for maybe some injection training, but maybe they haven't seen their actual medication yet. Maybe they have spoken to the pharmacist. But at that point, when they're talking about drug delivery, when they're talking about when the shipment is going to come, it doesn't dawn on them to think about the actual training for the injection itself. And a lot of times it might be days apart, weeks apart from when that conversation happens to when they actually receive the product. So it really gives an opportunity not only for the training to come at maybe a little bit more random times, but maybe it's not appropriate to when they're actually going to be using the training. So that's where the on-time ability to have something as a resource like a pharmacist and these extra tactics there when you're going to do your injection for the first time, that's the strength of that. And that's where we've seen various programs in the past try sending nurses to homes and things like that. I've been a nurse that's gone into homes and then taught how to perform injections and all these other things. And even for me, when I was doing that, it didn't dawn on me readily that the specialty pharmacy was a resource for me. It didn't sink into me that if I had an issue with, that product in that home, that was a resource that I could even reach out to. So, we need to make sure that not only that the patients have the on-time training, but that the healthcare providers that are out there also during the training understand what a resource and what a additional backup, the pharmacy is for these patients. And we do tell them how easy it is. We show it to them in the office. We show them maybe it's a two-step auto injector. It has no button. It goes by itself, and you just kind of push it against your skin. That all seems very easy in the office. And we use these words: simple, easy, no big deal, no brainer. And so when the patient gets home and they're alone, they're in their home and they're confronted with this now medical procedure that we've asked them to do by themselves at home, they don't know where to turn. And it would be great if they had a better understanding and a very clear path to know that they have a knowledgeable, educated, and prepared pharmacist ready to be there to assist them if they need it.
Yeah. The only thing I would add to that is, it's really, at that time, that patient doesn't have a grid or an understanding, even to ask an educated question, right? And sometimes it is the right information at the right time. And the specialty pharmacist and the physician are tasked with so many boxes to check, right? But when it comes down to it, is really trying to put ourselves in basically in the perspective of the patient and giving them a better understanding of when and the right questions to ask.
So we all know there are multiple parties involved when you talk about providing patient training throughout the patient journey. Tim and Terry, how do you see the coordination working between the pharmaceutical manufacturers, the specialty pharmacies, and the payers?
Yeah, I don't know. I think that's a problem they're all trying to solve. I'll start off at least with some perspective. It's interesting with integrated, networks and health networks. Part of that is simply, that's the industry has shifted to try to do exactly that, right? If you fall under all one system, it gives you a better line of sight and a treatment of care for that patient. But not everybody's going to fall within that line. We also say from a pharmaceutical, spending years on pharmaceutical brands, It's amazing, the resources and that a brand will try to do to build those bridges between those different groups, right? And that's, I believe, the whole reason hub services and specialty pharmacies or hubs first, were developed were to meet some of the challenges that the brands are facing with payers, right? Hubs came in and said, we'll take care of all the benefit verification processes if you pay us. And so pharma said, fine. So I think it's one of those, the brands that sometimes try to do that, but they struggle at the very finished part of getting to the patient. A lot of the services that are offered by a pharmaceutical company are, like say, are not utilized, or even the awareness is very low. And this is where we still see, I feel like the key person, I like to say all parties are necessary, but to me, the pivot point is really around the specialty pharmacy, that as they're delivering that medication, as they're building a care plan at that initial medical assessment. I never knew that from a brand guy, that the level of information and care that the specialty pharmacy was put in place around that patient. So I think that's also where that specialty pharmacies and their quarterly business reviews and things like that can tie in that patient to string throughout that journey. So that's some thoughts that I have. Terry, I'd be interested to hear any differences of opinion or anything addition you want to add?
Well, I tell you, it's interesting. These three that we identified here, the pharmaceutical company, the specialty pharmacy, and the payer, their focus is adherence, right? Because that's what's going to keep them all moving forward. So the pharmaceutical company wants the patient to stay on their drug. The specialty pharmacy wants to maintain as dispensing that drug, and the payer wants the drug that actually works for the patient. They're not going to be paying a bunch of money out to switch things around and try things that don't work. So, these are pieces where, and the payer also wants the patient to be on that medication if it's something that can prevent them from having hospital inpatient admissions and all these other expensive procedures. So every one of these parties, every stakeholder, and again, also the prescribing physician, are all motivated in this idea of adherence, because it would benefit every stakeholder involved. The patient would be able to get their potential symptoms under control. The HCP that prescribed it, the doctor that prescribed it, is able to be confident in the pharmaceutical company that now has a product on market. So every single stakeholder, it's funny, they're all interested in adherence. And the key piece to making sure that a patient sticks with a medication is knowing how to take it. And so if they are not comfortable in how to take this medication, whether it be an oral medication, injectable medication, IV, name anything, even a topical, if they're unsure as to how to handle this medication, and they know it's a medication, and Tim, you said it right, it's expensive, it took a lot of paperwork and effort to get it into their hands to begin with. Now they've come down to that moment of truth to where they've got the one pin in front of them, they've got to perform this injection, they've got all these other stakeholders they know riding on this, and the pressure falls to the patient. And if there's one thing we learn in healthcare, it's that when the pressure's on, very few people stand up, most people fall back to their training. So if we've established a very effective training program that has multiple contact points through the provider, the prescriber, the nurse there, and the specialty pharmacy, and they have the solid tools and tactics that we help design and provide around those, it creates a really great environment for training, so that when those high stress situations come up, or just the anxiety of performing an injection on yourself, when that arrives, the training is there and solid, and the technique is there, so that adherence can continue and all stakeholders can stay bought in.
So Tim, how big of a role do you see digital health playing in these programs? Beyond providing patients with a training device, do you see an opportunity to integrate remote patient monitoring into the offering?
Yeah, Sheila, it's a good question. I think it even kind of relates back to the previous question. How do we coordinate across these different stakeholders? I think right now, the currency of that coordination is in some type of digital aspect. The other thing, part and parcel to that, we do see not just that connection, but we do some of the like the materials and things that we've seen that deliver is simple, videos that are delivered, via your phone. It's learning to, it's being realistic sometimes, like giving the patients, what's the environment in which they want to learn, right? Digital. videos. We hear this all the time. Nurses and patients get their training off of YouTube, right? So how do we create a better digital experience, but that's not complicated? Sometimes what we've seen is it's not always about another app, right? That's the last thing you need is an app on your phone that you're not utilizing. But is it meaningful information given to you in a meaningful way? And there's technology that, that's being developed. I think there was an over push on technology a couple of years ago with COVID, with digital. I think there's been some scale back in trying to understand, did we overpay? How do we actually use it in a meaningful way besides just doing everything? And, it's funny too, at any one of these shows anymore, and everybody talks about, AI. What does that look like? I still haven't figured all that out, but I do believe there is digital parts. We have some technology that we've worked on with remote patient monitoring and able to see are things done correctly. I think if the patient's willing to accept that, I think it can go a long way back to connecting into the payer who's paying for these medications. You would think that they'd want to see that their medications are being utilized correctly, right? So if there's a way to be non-invasive, but to see the patients using their medication correctly through a digital aspect, I think that makes sense.
Yeah, it's a real Goldilocks attempt because Tim, you make a great point. Everybody thought we needed apps right first, right? Everybody wanted an app. It was huge. Every brand has an app. Everything's out there, and those have their value. But when we talk to patients, a lot of times they'll tell us, my physician has a portal, my pharmacy has a portal, I'm connected through this or that. So they will have some way of handling some of those more important things. What they really see digital as an aspect, or where they really see digital as a strong aspect, is in the training piece. Because when we put it in front of them and we say, when we're doing research, how would you want to learn how to do this? What would be ideal for you? They say things like videos. I would look it up on YouTube. Or we ask them, how did you learn to do your injection? You would not believe how many patients sit in front of us who say they never had anyone, not a single healthcare provider, tell them how to do the injection. They looked it up on YouTube and they figured it out, right? They got through it. But then there's so many risks to that because they don't know if the person they looked up on YouTube is necessarily a reputable person. Are they even a nurse? Are they a doctor? Do they know what they're talking about? Is it just some random influencer giving themselves an injection? So these patients are looking for a simple way to get the education. They like the idea of a video and step-by-step, but they also want it to have some sort of legitimate connection to their medication, their brand, their pharmacy. It needs to be something that has some sort of backing to it that they can feel confident in. Because again, this is something that they're performing on their own. And if they're in the unfortunate situation where maybe their healthcare provider did not give them proper training, they need a solid digital resource to fall back on. And for most of these patients, it does seem to be, videos, step-by-step visuals, and then making sure they have the resources to use if they do run into a problem in those moments. Digital, I don't think it can be understated how powerful it can be. We just have to find the right amount of it for these individual patient populations, and it may not always be the same.
So Terry, if patients need additional support beyond their training kits, do you feel it would be better for them to contact their HCP or their specialty pharmacy? What's your opinion?
It's going to depend a little bit if it's a situation, because you're going to run into patients who are going to have different levels of trust issues with their prescriber, right? With their HCP. So, some patients are naturally going to think I should call my doctor for everything. Right, everything, especially if they're in a little bit older generation, that sort of thing, and maybe they had a really good connection with their doctor. They've had the same doctor for 40 years, and some of them, to the point, may have had the same pharmacist for the same amount of time as well. When you actually used to get to know your pharmacist, right? When you knew who was getting you your drugs. So it would depend on the situation, but I would say for most patients we talk to, they don't exactly do these injections Monday through Friday, 9 to 5. Okay, right. This is a situation when they typically will do these after work during the week. They're going to do them over the weekend. They're going to do them after they've stared at it in the fridge for 4 days and haven't quite built up the mustard to do it yet. They'll finally have the ability to do it, and they'll sit down, and it's Saturday, and something will go wrong. Right? Some little thing, or they'll be a little anxious. And so it's about finding that resource that is appropriate to the issue they're having and making sure that it's available. That's why a lot of times in the research we do, the suggestions we get, especially related to digital connections, are having that ability to list out the brand support that's available, the specialty pharmacy support that's available, and then they know how to contact their HCP. And we also guide them a little bit, for drug product concerns, for delivery issues, for things like that. And we try to direct them as to where to go if they're having a situation where they're experiencing side effects or they're having some sort of exacerbation of their disease. Of course, we'd want them to reach out to their doctor and get direct medical help. But if it's a situation where it's something that can be answered by the pharmacist, or it can be answered by a nurse in a hub system or something like that, then let's get that in front of that patient so they know where their resources are, so they don't automatically think every single time it should be my doctor, because these doctors' offices, they'll tell us over and over, we get too many phone calls. People call us for stuff that somebody else could have answered, other than us. Yeah. They're happy to do it. Don't get me wrong. They don't exactly complain, but they're making it very clear. It's like they call us for everything.
Well, Terry, you're reminding me I'm thinking of two stories, one that we just heard recently and one that we heard about a year ago. But we were working with a large brand, pharmaceutical brand, with a $1 billion product, lots of patients on drug. And they have a 1-800 number for the nursing hotline, right? The call if you have questions, and they make that service available. Thousands of patients on this medication, and so we asked the question. It's a simple question. Well, how many patients called that phone number last year? And the guy goes, 8. So you sit there and related to that, we had a patient came in last year to give a patient testimonial, was giving us her perspective on medications, the industry, and training, and she got home with a self-injectable medication, made a mistake for the first time when she was going through it, and we asked her, like, well, why didn't you call the nurse hotline? And she goes, I didn't want to bother them because I know nurses are busy. And so in one sense, our medical profession has taught patients that, how many long we sit in a doctor's office for a long time and they're busy. And this lady automatically assumed that the 1-800 number on her carton was to a nurse that was too busy and she didn't want to bother him. And so it's both. The services are right in front of them, right? Or there's even sometimes, but unfortunately, what's been communicated, or maybe not on purpose, but is like, if they see that resource, are they going to utilize it because they already feel like, oh, I don't want to bother anybody?
Oh, you're right. And of course, I'm in the back of the room, Sheila. You can imagine losing my mind when she's saying this, because it's like, oh my gosh. Like, I totally get that. They think, but part of this is because when they're in the doctor's office, we're all running around like crazy too. The doctor's in and out as fast as he or she can be. The nurse is in and out as fast as he or she can be. They get you in the door and out the door as quick as possible. Why would they think anything else? Why would they think that nurses who are on the phone have any more time than every other nurse they've ever interacted with? There's no good reason for them to think that they have extra time to help them, and that's heartbreaking. That's heartbreaking. And I even raised my hand. I said, just so you know, that's why we exist. We exist to help you when you're not sure. Those things are there for that. But yeah, we consistently talk to these brands, Sheila, who say, oh yeah, we have nurse support lines. They never get utilized. They'll just be open with us and they'll tell us. And it's like, now, well, maybe there's an opportunity there. Maybe there's an opportunity that, if a specialty pharmacist is having a discussion with a patient, or if there's a resource or a tactic that's sent out that does have a digital component that's monitoring how well a patient trains, maybe there's an opportunity to focus those nurse support lines into actually being more interventional than necessarily just there in case a patient has a need, right? So there's lots of opportunity in this industry to allow us as nurses to get in there and do an assessment. I mean, that's part of being an RN is being able to assess a patient and assess a problem to help and recommend interventions. The nurses aren't even getting a chance to do that inside these hubs and inside these brands for these patients that probably need these services.
Right. Well, I think, and that goes back to the care coordination, right? I think we should spend some time, all these different stakeholders, reinforcing that message, right? This is who you call when this happens, right? And, and assure them, no, you're not being a pain or a problem. This is what we're here to do, because as I think, Tim or Terry, you said, we want patients to use their medications correctly, right? Because it's just not good for anybody if they don't. So how can Noble's engagement programs complement other forms of patient training, such as nurse educators?
Well, I'll take this one, and then you take this one.
Go ahead.
So, no, I think, I think really what's been interesting, I think hopefully anything that we do is not causing problems. We want to fix problems and solutions. And I think, really some of the approach we've taken here at Noble is I always challenge the team. Let's how does it live in reality? Let's camp it out in reality. And so even when we're looking at these programs that we're implementing through specialty pharmacy for patients, it is really understanding. I kind of get it down to it is three main pillars, maybe even four, if you would say that. If it's around our training devices, it's part of our digital, and it's part of the delivery of all those things. It's content and delivery. And it's working within the ecosystem with the patient already is, right? So, I think this is where we have to complement. I think it's obviously since Florida won the hockey game, you got to have multiple shots on goal, right? And so that being said, this is where, patients not only, receive information in different ways, training and education. This is where we provide a tangible asset in the hands of a patient, a training device where they can make their mistakes and they can reset it and make another mistake, and learn correctly and do those things, but complemented by written instructions, a digital supplement, right? And then having it delivered in a timely way through an engaged party like the specialty pharmacy. And so, I think what we've seen, in a pilot that we did last year, we really saw that it's the right, if we can deliver the right materials, simplified in a way a patient understands and can deliver it at the right time through the right medium, it can have a beneficial effect on patients' behavior as it concerned to adherence. We saw that patients in our programs were able to start their therapy sooner, which, I call it inertia, right? If you're starting your therapy, you're more likely, if it's a good experience, to stay on it. But if you keep delaying and delaying because you're scared and you're anxious and you're waiting for the perfect day or to feel fully empowered, it may not happen. That becomes abandonment. So starting sooner is a big thing. But then if you're equipped, if you have that good first date or that good first experience, odds are you're going to make it to that second one and that third one. It also means that onboarding and training and having the right materials at the right time. If you're a patient that might be at risk, you now have a grid or an opportunity to ask questions that you didn't know. You can be an educated student of the medical procedure that you need to ask the pharmacist or the HCP. So I think this is where we're seeing our programs. We really want to first camp out in reality, but then make sure it fits in with the system in which that patient is living in that journey. I don't know, Terry?
Yeah, I mean, it's funny. This is a really interesting question because as a nurse, I'm going to be slow to say anybody can do it better than we can, but I'll be perfectly honest with you. Our main goal as nurses, what I was taught in my education, was that we are educators first and foremost. So that is where we should shine. It is in education, and so in order to do that, there's two things. Number one, we have to understand the device we're working with and the procedure itself. And then we have to be able to allow the patient to make mistakes. Tim, you said something really powerful there. You said it allows them to make a mistake and reset. That's enormous. The whole piece of good education is being allowed to make the mistake and it not be detrimental to your moving forward and being successful. So if I'm sitting across from you as a nurse and you go to do something incorrect, whoa, wait a minute. Okay, let's make an adjustment. Let's adjust that, right? Let's do it again the right way. If I've got a training device in my hand, or the patient has a training device in their hand while this is going on, they're not only getting verbal instruction from me, they're getting education from me about the other piece of it, but they have something tactile in their hand. So they're able to actually go through and get the muscle memory piece and get those other pieces all while learning and just enhancing that education piece. The really fascinating part is when somebody tried to offer education over the phone. with a training device, because I just spoke to a specialty pharmacist in some research that described to us a situation to where the specialty pharmacist had a training device with her. The patient had an actual product in their home, and the specialty pharmacist was doing the best she could to do injection training for this patient, but the patient had an actual product. So she could not make a mistake. The specialty pharmacist could go over and over and say this part, this part, this part, but when the patient had to do it, she had one shot, one try. And if she messed it up, all that education was still worthwhile, but she didn't have the equivalent educational tool that the specialty pharmacist had. Had that patient had a training device, they could have gone over it and practiced 2 or 3 times. Pharmacist has one, patient has one, everybody's comfortable. Pharmacist stays on the phone, boom, successful injection. That is powerful education for over the phone when you can include some hands-on training as well. So, it's I don't see it at all necessarily as a replacement for nurse educators. I think it's an adjunct and it's an enhancement. If your product has the opportunity to potentially need education outside of the clinic, where you're thinking we might need nurse educators, it is a no-brainer to empower those nurses as best you can to make sure the patients have access to a training device.
Well, and Terry, that being said, even if there's that patient who's at risk and a visit is made and a nurse comes in and, spends an hour going through things, that nurse still has to leave. They leave. Right. And so what happens with that patient, a week or 2 weeks later? You're not going to send the nurse back out again, right? Probably not. Though they could, but now your expense is definitely going up. But obviously then that patient may not be suitable for self-administration. But yet I say that, that nurse is there and that patient was trained properly. There's tangible things that need to be left to help that reinforce that behavior, because a week later or 2 weeks later, it's still the same challenges are going to come up again, right?
Oh, we see it in research. We have people who come in who are like, I would never inject myself. That's not something I'm interested in. But if they get exposure to the product, they get a couple times to actually use the training device, maybe in the research. Maybe we've been talking to them about other pieces of it. Then they suddenly become open to the idea. It was, well, you know what, if I had something like this, or if it was like this, or something, if somebody taught me how to do it the way you all did, then I think I could do it. So we see patients actually, mature in their acceptance of an injectable right in front of us in research all the time, just from the exposure to the device in a safe environment where they can practice. Tim, to your point, they can practice over and over and over again, so that when they actually think about doing the actual product, it's nowhere near as intimidating or anxiety causing.
Right. And a lot of these medications, right, aren't administered every day. So even if it's, once a week, right, they might get out of practice, or once a month, even more so. So being able to kind of play with it in between, I'm sure helps to, increase their confidence as well.
Oh, absolutely. I have visions of patients out there, in the home, pulling out their training device, going through the motions, because it might be a great point you're making, by the way, that it could be a month, 2 months, 6 months in between some of these injections, right? So the forgetting curve has a real opportunity there. And I don't know about you, but I do pretty good to remember what I did last week. If it's something that was high anxiety causing, my memory probably faded off a little bit. So if last month, maybe it didn't go great, and this is my second injection, now my anxiety level is even higher, and I'm further out from when I had my initial training. What am I supposed to do?
Yeah, and this is where I think, you look at, a lot of times we hear that patients will have some type of routine, especially if it's something like weekly or biweekly, and a lot of times revisiting these materials and injection training devices during that time is something that they do. I think this is also where it goes back into, there's ways the digital component can help complement and supplement and help reinforce the right behaviors and a quick check-in, right? And then maybe even if there's feedback loops within that, where they can provide feedback to either the brand or to the specialty pharmacy. This is where we're really looking at that digital part playing a part to constantly improve the program, right? Because, that first injection is all that is very important, but it's funny that we've seen utilization of these training devices and kits and things more than just once. Utilization usually it goes across several of the injections, and I've seen some patients talk to some patients that it's just part of their routine.
It is. And, up to this point, we've really only discussed patients doing this themselves. These patients have caregivers. So if there's a patient situation where they have a caregiver and all of a sudden there's a loss of that caregiver, having the resource, the digital resource, the paper resource, the training device to be able to bring that next or short-term caregiver up to speed very quickly without having to go to the doctor, without having to, do anything else. They've got those resources right there in the home. So that this new caregiver and the patient who's getting the care are both confident in the technique of the person doing the injection. So it's a resource that we see it's one of the few resources for injection training that is evergreen in nature, is that it is just as powerful for 6 months or 12 months down the road from the initial training as it is on the first day.
Sure. So we've been talking a lot about care coordination. So let's get down to it here. Terry, how comfortable are HCPs with relinquishing a portion of that patient treatment plan to specialty pharmacies?
It's interesting when we ask questions like this in research, Sheila, that's a great question. When we ask it, they're okay with it, but they're a little surprised that the capability is even there. So when I sit in front of nurses, I sit in front of doctors who work in clinics I say, what's your interaction like with a specialty pharmacy? Oh, I'm on the phone with them all the time. Cool. What about trying to get prior auth? Okay. Anything else? Not really. Okay. Well, do you know that, would you expect them to have a piece in the injection training? Would you know they do it? No, I don't even know if they do that. Okay, very good. If you did, would you be comfortable with that? Yeah, absolutely. It's another layer. So I think it's a bit of an assumption that they feel like they're the only ones doing it. I don't think there's a real solid understanding among a lot of our prescribers and our nurses out there that understand that the resources are even there. Perhaps they're so busy, they're so covered up with everything. They've just found an efficient way to do it, and they do it, and it's done, and they take it off their plate. They don't, I routinely ask prescribers, this is my favorite question that I get to ask them is, great, you've prescribed somebody maybe an injectable biologic medication, you've given them their training, they've refilled the prescription after the first time. How do you know they did it right? And it's silence. Okay, how do you know they're doing it right 6 months from now? Silence. They have no idea. They're assuming. They're assuming these patients are doing this right, and the only thing that tells them if they're not is if they don't get a refill request, or if the patient shows up with new symptomology or exacerbation of symptoms. That's unacceptable. That is where we are right now. Is that this is a medical procedure that's being prescribed for in the home, and there's no good way. There's no good consistent touch point to make sure that this patient is doing this correctly beyond the prescriber in their mind. However, you and I both know that specialty pharmacist is somebody that is going to touch that patient. Let's say it's a monthly prescription or weekly or whatever. They're going to touch base that patient on a monthly basis. That's an opportunity to have those conversations, to have that follow-up, to check on problems, to check in for issues that are going on, and then to potentially head those off or resolve those using some of these support tactics that we're talking to. Because these prescribers would love to know and love to feel confident that their patients are doing their injections correctly. So I think if it's a situation where we can get them to the understanding that the specialty pharmacist and they are an additional layer, not a replacement layer, not something that's optional. They're an additional layer of training and adherence follow-up that is there, and it's available, but they don't recognize it very quickly, or they don't recognize it naturally, right? They've gotten so used to just handling it themselves and moving on that they don't see it there. So I think, I think they'll feel much more comfortable around the idea once they fully understand all the capabilities that a specialty pharmacy has, and then all the tools they have at their disposal, such as training kits, digital offerings, all these other things that are out there. If they knew that these things are out there, they're more open to it. And when we introduce them in research and we say, would you be comfortable with your patient receiving this kit? Yes. Should it be an opt-in or standard? Standard. Right? They tell us they want this in the patient's hands so they can feel confident there's something there and there's additional resources there. So they can, they know these patients are doing it properly beyond that initial training, because there's just not a real great feedback loop for them right now.
All right, Tim and Terry, any closing thoughts?
Well, first of all, I just want to thank you guys for having us on today. I really appreciate the collaboration and the spirit which NASP brings in, and folks like us and other folks. And I just say, it's a fun journey that we're on. I think I think go back to some of these questions about connecting all the right people in the right way. It's not just one party that's responsible for all of this, right? There's shifts in healthcare that move things to the home, and from an economic and all sorts of other reasons. But I think it really is realizing that when we can have benefits for all the stakeholders, but there's challenges with all of this as well. But I think it's being open-minded and reaching across the aisle and talking to folks that we've never talked to, and building alliances where we didn't know there needed to be a bridge or support put together in the first place. So like I said, I feel like we're making the steps. NASP and the specialty pharmacists are doing that as well. So I thank you for this opportunity to kind of tell a little bit of what we do and the insights and things we bring. Terry, I'll give you the final word.
I echo Tim. As a nurse and as somebody who's getting a chance to speak to, especially pharmacists, it's fantastic learning from my perspective everything that the pharmacist can perform, right? And so it's really just being a unified front as healthcare providers and understanding what these patients need, and then moving forward together to make the patient outcomes as best as possible.
And how do folks get in touch with you, real quick, if they want to learn more, or they want to partner with you?
Well, you can go to our website, gonoble.com. That's GONOBLE.com. And there's ways to reach out and contact us, or, you can email me at tim.mcleroy, MCLEROY, at gonoble.com. So we're easy to find. You can find me on LinkedIn as well. So happy for anyone to reach out and connect.
Awesome. And NASP can connect folks to you as well.
Absolutely. NASP, we're in the directory.
Perfect. Thank you, Tim and Terry, for chatting with me and sharing this valuable information. As a reminder, NASP corporate members are invited to be my guest on one complimentary podcast per year. For more information about this or other NASP membership benefits and events, please feel free to reach out to membership@naspnet.org or visit our website at www.naspnet.org. Until next time, have a great day.